The following video is based on researches and case studies gathered from different books, media, internet, space, etc. Newtern, the channel or the producer do not accept any responsibility or liability for the accuracy, content, completeness, legality or reliability of the information contained in the video. The video is made solely for educational purposes and is not created with an intent to harm, injure or defend any person, body of persons, association, company or anyone. This video is not intended to spread rumors, offend, or hurt the sentiments of any religion, communities or individual, or to bring disrepute to any person, living or dead. The viewers should always do their diligences, and anyone who wishes to apply the ideas contained in the video take full responsibility for it. Also, it is done on their own risk and consequences. The material contained in this video cannot replace or substitute. Newtern, the channel and the producer do not take responsibility for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly on account of any actions taken based on this video. Newtern, the channel and the producer of the video disclaim any kind of claim of libel, slander or any kind of claim or suit of any sort. Viewers' discretion is advised.
Since COVID-19 came to India, people are looking out for all sorts of ways to protect themselves. Be it practicing hand hygiene or wearing a mask, you are doing everything possible to keep the virus at bay. There have already been many speculations to determine for how long the virus survives on different surfaces. According to a study by the National Institutes of Health, USA, COVID-19 can thrive on cardboards for 24 hours, while on steel and plastics it can live up to 3 days. Several studies claim that it can also live on your shoes for a maximum of 5 days. Since most shoes are made of leather, rubber and plastic, they can become another carrier of the virus. Infectious disease specialist Mary E. Schmidt said that the time of survival of the virus can actually be 5 days or more, according to several studies done on materials closely related to shoe materials at room temperature. According to Georgine Nanos, who is a family practitioner in USA, shoes can be a potential source of contamination, especially if they're worn in heavily populated areas such as markets, hospitals, workplace, etc. You can also be a possible carrier of virus if your shoes touch an infected place or someone who is already infected sneezes or cough near you. Those droplets might land on your shoes and can also infect you. Another reason why shoes can be a breeding ground for bacteria and viruses is that it comes in contact with dirt and germs more than anything else. Virus and bacteria can breed on the sole of the shoe and might even get carried to your home. In order to protect yourself and your family, it is best to take the following precautions to ensure that you are safe from contracting the virus. Remove your shoes before entering your house. Wash the shoes worn to public places with water and soap. Shoes which are machine washable can also be cleaned in the washing machine. Leather and other materials which couldn't be washed with water must be wiped properly with a disinfectant. Place a clean pair of slippers or shoes outside your doorstep and change into them before entering your house. Can the coronavirus live on food packaging? For how long? Experts advise how to decontaminate during the pandemic. The coronavirus is thought to spread largely via person-to-person contact, but it can also live on surfaces, including food packaging, for several days. While some how-to videos and articles are encouraging people to disinfect grocery containers, mail and other packages entering the home, experts say that is probably overkill. Below are step-by-step tips from experts about how to get what you need from the store and limit your exposure to the virus as much as possible. Limit your trips and go when stores are less crowded. Experts advise limiting grocery trips to once every 2 weeks, if possible. This may mean stocking up on dry goods, and frozen or canned fruits and vegetables. If you can, plan to shop during off-peak hours. Some stores are setting aside times for older and immune-compromised people to shop with reduced crowds. Keep a distance of at least 6 feet from other shoppers. Plan what you need before you go to minimize your time in the supermarket. Clean your hands and disinfect your cart as soon as you get there. Use hand sanitizer, and touch only what you need to touch. Wipe down your cart handle, and then use the hand sanitizer again, said Elizabeth Ekstrom, professor and chief of geriatrics at Oregon Health and Science University. Shoppers should also avoid touching their phones or wipe them down after any possible contamination, said Julia Marcus, an infectious disease epidemiologist and professor in the Department of Population Medicine at Harvard Medical School. Gloves are not necessary, she said. Generally, when we use gloves outside of the healthcare setting and just in the community, they tend to become like a second skin. We end up touching our faces, and they may actually make us feel like we're not at risk, but they themselves can become contaminated and may actually be a better surface for the virus to persist on than our own skin, she said. You don't need to sanitize food packaging. While the coronavirus is not thought to be transmissible via food, it can live for several days on materials used to package food. Preliminary research shows it can survive on cardboard for 24 hours and on plastic for 72 hours. But the amount of the virus also quickly declines during that time period. The U.S. Centers for Disease Control currently does not recommend disinfecting packaging. And Marcus said shoppers should instead thoroughly wash their hands after handling any item that might have been touched by others. At this point, there's no evidence that transmission is happening through food packaging. That said, we know the virus can remain viable on surfaces for hours or even days, so there's a hypothetical risk of transmission through touching a contaminated surface and then touching your eyes, nose or mouth, Marcus said. Better than disinfecting, the thing we keep saying over and over again is to just wash your hands. Donald W. Schaffner, a food microbiologist and professor at Rutgers University, has firmly pushed back on viral advice for people to disinfect food packaging. Right now, there's no evidence that the virus is spread through food. There's no evidence that it's spread through food packaging. That doesn't mean that we might not learn new evidence tomorrow that would change our thoughts on that, but right now that's what we believe, Schaffner said. While the U.S. government has provided a list of cleaning products that can kill the virus, most of them should not come into contact with food. Schaffner said people using them may expose themselves to chemicals that are designed for use on hard surfaces, not disinfecting groceries. Food safety experts also say produce should be washed only with water and not household dish soap. Do not go to the store, or any public spaces, if you have been exposed to the coronavirus or are experiencing symptoms. People are thought to be most contagious when they are exhibiting symptoms. But the virus can also spread from people who don't yet have symptoms or who have the virus but never get sick. If you are 60 or older or have a compromised immune system, have your groceries delivered early. Statistics show that the older you are, the more likely you are to get critically ill or die if you contract the coronavirus, Ekstrom said. The CDC finds that the death rate for people 65 to 84 years old is 3% to 11%, and the death rate for people 85 and older is 10% to 27%. Age matters, Ekstrom said. And then if you've got chronic illnesses, and those kind of boil down to heart disease, lung disease, diabetes, immunosuppressed status, then you'll also have to be much more cautious. If you have groceries brought to you, asks the delivery person or friend or family member to leave the bags outside. Tip electronically, if you can. Clean any surfaces the bags touch, and wash your hands thoroughly after storing food. Experts also advise frequently cleaning high-touch surfaces in the home, including door knobs and light switches. Here's how to help prevent the coronavirus from spreading. 1. Stay at home. 2. Keep distance. 3. Keep hands clean and wash. 4. Keep in mind that no one else is vulnerable during cough. 5. Call the helpline immediately if your health worsens. 6. Wash your hands regularly with soap and water. Also keep it clean with the help of sanitizer. 7. When coughing or sneezing, place a tissue paper or elbow on your nose and mouth. Do not move the hand directly to the mouth, there is a risk of spreading the infection. 8. Keep a distance of 1 meter from the patients. 9. If you are not feeling well or feeling ill, then you should keep yourself away from the rest of the people and stay in solitude at home. 10. If your hands are not clean, then do not wipe the mouth, nose and eyes from it. Don't leave your home, stay in, stay safe. Like this video. Comment. Share. Subscribe. Thank you for watching this video.